Good day, everyone. I am Julian Patricia B. Sarmiento from Mabini College's PSN 1B, and for today, I will be performing a return demonstration on the assessment of the male genitalia and rectum. Prior to the procedure, we have to check for the doctor's order to ensure if we will be conducting this procedure to the patient. To examine the client efficiently, we have to make sure that we have all the equipments needed, and we have to perform a hand hygiene, which is the hand washing and hand sanitizing before and after the procedure. So, before we start, we have to identify ourselves as well as identify the patient, provide privacy, and explain the procedure, why it is necessary, and how can the client cooperate in this assessment. We also need to conduct an interview to know the past health history of the patient and to know their chief of complaint. Also, we have to maintain confidentiality. Good day, sir. I am Patricia, your nurse for today. May I confirm your name and your birth date? So, I will be assessing your genitalia and your rectum to check if there's any problem or any abnormalities that we need to take note to prevent further complications. So, I will be needing to perform the inspection and palpation. Is that okay with you, sir? And also, I will be needing your cooperation with this assessment by following all the instruction that I'm going to say. Okay? So, we will be now preparing our patient by asking them to change their clothes and put on the gown for us to be able to access properly. Also, we will be placing the patient in a supine position first, and we need to have adequate lighting to visualize the genitalia properly. So, I will be now stating to perform and assess the genitalia. First is the penis. Inspect the base of the penis and pubic hair. Note the pubic hair growth pattern and any excoriation, erythema, or infestation at the base of the penis and within the pubic hair. And as what I can see, the pubic hair is coarser than scalp. Hair and the base of the penis and the pubic hair are free of excoriation, erythema, and infestation. So, next is we inspect the skin of the shaft. Observe for rashes, lesions, or lumps. As what I inspect the skin of the penis is wrinkled and hairless, which is normal and free from rashes, lesions, or lumps. So, we palpate the shaft. And as I palpate, the penis is soft, flaccid, and non-tender. Next is we inspect the foreskin. Observe for color, location, and integrity of the foreskin in uncircumcised men. And as what I can see, the foreskin is intact and uniform in color with the penis. So the next thing we need to do is to inspect the glands, observe for size, shape, and lesions or redness. The glands' size and shapes vary, appearing rounded and broad. The surface of the glands is smooth, which is normal, and it is free for lesions and redness. Next is we need to palpate for urethral discharge. We gently squeeze the glands between the index finger and thumb. So the urinary meatus is normally free of discharge. Second is the scrotum. Inspect the size, shape, and position of the scrotum. Observe for swelling, lumps, or bulges. So, we ask our patient to hold his penis out of the way. So, as I see, the scrotum varies in size according to the temperature and shape. The scrotal sac hangs at the level of the penis. It is usually not symmetrical, which is the left side of the scrotal is lower than the right side. and this is normal. So, next, inspect the scrotal skin. Observe color, integrity, and lesions or rashes. The skin is thin and rugated with little hair dispersion. Its color is slightly darker than the penis and free from lesion and rashes. The next thing we need to do is we need to palpate the scrotal contents. We palpate each testis and epididymis between our thumb and first two fingers. Note that the size, shape, consistency, nodules, passes, and tenderness. It is equal bilaterally in size and shape. They are smooth, firm, rubbery, mobile, free of nodules, and tender to pressure. The epididymis is non-tender, smooth, and softer than the testes. So the next thing we need to do is palpate is each spermatic cord and the vas deferens from the epididymis to the inguinal ring. The spermatic cord will lie between my thumb and finger. Note for any nodules, swelling, or tenderness. The spermatic cord and vas deferens feels uniform on both sides. The cord is smooth, non-tender, and rope-like. Next is the inguinal area. So first is we inspect for inguinal and femoral hernia. We inspect it for bulges, so we ask our patient to turn their head and cough. So the inguinal and femoral areas are normally free from bulges. So we need to palpate for inguinal hernia and inguinal nodes. In inguinal lymph nodes and palpate for femoral hernia. And lastly is the anus and rectum. So we will be placing the patient in a Sims position. So we inspect the perineal area, inspect the anal opening and surrounding area for the lumps, ulcers, lesions, rashes, redness, fissures, and thickening of the epithelium. And the next thing we need to do is to inspect the sacrococcygeal area for any signs of swelling, redness, and dimpling or hair. And as what I can see, the area is smooth and free of redness and hair. And then the next is we palpate the anus. So we will be informing our client that we're going to insert our index finger. So as I insert, the client's sphincter relaxes, permitting to entry, which is normal. And the next is we palpate the rectum, noting the tenderness, irregularities, nodules, and hardness. And as I palpate, the rectal mucosa is soft, smooth, non-tender, and free of nodules. And then next is palpate the peritoneal cavity, noting the tenderness or nodules. And then lastly is palpate the prostate. So it is not non-tender and rubbery, which is normal. So after all the procedure we did, we will now document all of our findings, place the patient in his normal position, and clean the equipments, the area that we used. So that is the proper procedure on the assessment of the male genitalia and rectum. That's all. Thank you.